Hi, I'm Susan Taylor with Scripps Health in San Diego, California. You are pregnant, about to become a parent. Up until now, your OBGYN has been taking care of you, but once your little bundle of joy arrives, you're going to need a pediatrician, a doctor who specializes in caring for children from birth through their teenage years. This doctor is a critical partner in your baby's health. So how do you pick a pediatrician who is right for you? Joining us to talk about this is Dr. Dania Lindenberg. She is a pediatrician with the Scripps Coastal Medical Group in San Diego, California. Doctor, thanks so much for being with us.
Thank you so much for having me.
So go into a little bit more detail. What is the role of the pediatrician?
We like to think ourselves as a guide for the entire family unit, helping a family adjust to having a baby, a child, a teenager, and then into adulthood. We really focus on physical, emotional, and mental health needs of the whole family unit.
And then what should you be looking for when choosing a pediatrician?
You really want to find somebody that you feel comfortable with, somebody you feel comfortable confiding in, asking questions of, somebody who aligns with your values, who practices in a way that feels comfortable for you, and surely a practice that is convenient for you, especially in the first year where you're going to be coming quite a bit to the pediatrician with a newborn.
And what kind of research should you be doing when you are looking for a pediatrician?
That depends on how you are in your personality. Some people want to find out everything from the office location, the office policies, after hour policies, insurances that are accepted are definitely important. Other people may take take word of mouth from a very trusted friend or colleague or doctor and say, if that person likes this doctor, then I'm definitely going to like this doctor. So it really depends on you.
And what kind of services does the pediatrician offer?
We often see the newborns, if they're born at a hospital, we have privileges at right away at birth each morning that the family is in the hospital. And then we see the baby multiple times in the newborn period, making sure they're gaining weight well, that feeding is going well, that the family's adjusting well to having a baby. And we deal with both well care and sick visits. So when your child is healthy, we just make sure they're growing well and things are going well. And when they're sick, we see them as well. So we really are the full package for a child.
So what should you consider when finding a doctor who fits your needs?
You want to think about what kind of things are important to you as a patient. So is the gender of the doctor important? The culture, your culture, are they understanding of your cultural needs? What languages does that doctor speak? And perhaps English is not your first language. For example, I often do visits in Spanish because a lot of our patients are Spanish speaking. And then just generally, which is harder to find, care philosophy. How does that doctor practice? Are they open-minded to things that are important to you?
And what services are offered if your baby is sick after office hours? Do they have somebody, do you have somebody on call, or is there some type of alternative care?
At our practice, we do. We always have one of us on backup call. During the day, we have a nurse triage service from Scripps, and after hours, we use a nurse triage service. Different practices have different policies. We run some Saturday hours. Some other clinics may have evening hours. So that is something good to find out about the practice you choose.
And what about it being a group practice? If it is, and there's, several pediatricians, can you request the same doctor each time?
I think personally that's a really important thing. And in our practice, we are a group practice, but we all really like to have our own patients just so we really get to know them. However, there is a benefit of a group practice in that if ever your physician is out or it's an acute visit or they're sick, right? Your child needs to be seen and your doctor's busy, you're not there, they can see somebody else. So I think the advantage is where in a practice, you get your doctor, but there are backups in case of need.
And what about talking to the mom about breastfeeding? And, do you offer breastfeeding support as well?
We definitely do. Breastfeeding is a huge part of what we do. That being said, we never want to make anybody feel badly about the way that they choose to feed their baby. And we like to support the family's health as a whole. If a mother would like to breastfeed, I certainly support that. And we have lots of resources we can refer to help as well.
If the mom has given birth to a boy, what about circumcision for that male infant?
Generally, in our practice, we do our circumcisions usually within the first couple of weeks of life in our office, just because that's where we're set up. I do them routinely. I've done many of them, and we happily do that for people. We do not push them either way to do it or not, but it is something to find out from a potential practice if that is something that the practice offers.
And after you've given birth, should you expect the pediatrician to come to the hospital to see your newborn?
Yes, it might not be the pediatrics group you choose, depending on which hospital you give birth at. For example, here where we are located, we have privileges at a hospital across the street. So if you deliver at that Scripps hospital, and you name us as your pediatrician, we will see your baby each morning. However, if you are born at an outside hospital, we would pick up care after your discharge. But a pediatrician on staff there will see your baby every day. So yes, your baby will be seen.
And then when you get home from the hospital, how soon should you be making an appointment to see the pediatrician?
Generally, we like to see our newborns within about 1 to 2 days after hospital discharge. Sometimes there can be a day or two more, depending on if it's a weekend or if the baby's been admitted for quite a while already. But that's the general rule of thumb I like to tell people.
Dr. Lindenberg, you also have medical interests in weight management, nutrition, and endocrinology. Talk about that with regard to the mom and baby.
Some common things that may come up in these categories are overweight or underweight, or if somebody is growing very slowly. These are very common parental concerns that we take really seriously and want to try to help the family work through.
So when should moms-to-be set up a time to meet and greet their new pediatrician?
Generally, parents to be should meet us if they would like to. We're always happy to do so, probably within a couple months of delivery, when things are really starting to feel real for them and they're starting to want to make a firm decision of who they have as a pediatrician. It's extremely helpful to have that chosen before giving birth, so that there's not yet another decision or something up in the air to have to decide at that moment.
Any final thoughts, doctor?
I just really want my patients always to know that there are no dumb or silly questions. People often preface their questions with saying, "This may be a dumb question, but," and I always interrupt and say there are no such thing. Honestly, anything they ask have probably been asked before. Questions about how to hold a baby, what about this rash, diapers and cleaning, all these things, and many others are all good questions and things that you shouldn't necessarily know before you do them. So please feel free to ask those things. You should be made comfortable. Please feel free to reach out if I can answer any of their questions. And I wish you the best of luck in this process and journey.
Doctor, thanks so much for being with us. We appreciate you taking the time.
Thank you so much for having me.
If you want more information on how to choose a pediatrician, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.